Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hemorrhagic shock and its classification. So it is divided into 4 classes. So let's look at class 1. So class 1 of the hemorrhagic shock. So here there is a blood loss. So BL is about less than 15. So how is the pulse rate? Pulse rate, it continues to be less than 100. And when you look about the BP, it remains normal. The pulse pressure, it may be normal or it is increased. The respiratory rate, it is about 14 to 20. And looking at the mental status of the hemorrhagic shock, it is in class 1, it is slightly anxious. So there are slightly anxious. And when you look at the UO, that is the urinary output is in the ml per hour, and this is greater than 30. Now we move on to the class 2. So in terms of the class 2, it is a blood loss it is about 15 to 30. So as we increase the classes, the blood loss, it significantly increases. Now what about the pulse rate? The pulse rate, it was less than 100. Here it is. This was in type 1. Here it is 100 to 120. Now when you look at the BP and the PR, the BP, it remains normal, whereas the pulse pressure, PP, it remains decreased. The pulse pressure, it decreases. So what about the respiratory rate? Respiratory rate, previously it was 14 to 20. Here it is going to be 20 to 30. Then we look at the MS. MS is the mental status. Previously it was slightly anxious. Here it is going to be mildly anxious. Now what will be the urine output? Urine output is calculated in ml per hour. So previously it was greater than 30. Here as we move ahead, the urine output, it decreases. So urine output here is going to be 20 to 30. Next we look at the class 3. So in terms of class 3, the blood loss will be 30 to 40. So blood loss is 30 to 40. And what about the pulse rate? The pulse rate is going to be 120 to 140. So as we increase, the pulse rate increases. And what is the BP? BP is the blood pressure. Blood pressure is going to be decreased, and the pulse pressure is also going to be decreased. Then the question arises on the RR, respiratory rate. The respiratory rate is about 30 to 40. And what is the mental status? The mental status is going to be, it is anxious, as well as the individual is confused. So the urine output, it decreases. So here in class 2 it was 20 to 30. Here it is going to be 5 to 15. Then we move on to the class 4. So in terms of the class 4, it is the blood loss greater than 40. The blood loss is greater than 40. And what is the pulse rate? The pulse rate here is greater than 140. And the question arises on the BP as well as the PP. The BP is going to be slightly decreased. So the BP was normal only in 2 cases, that is in class 1 and 2, where the blood loss was less than 15 and 15 to 30 respectively. So the BP here, class 4, it is decreased greatly. So it is a significant decrease in BP. The pulse pressure is also decreasing. Next we look at the RR, that is a respiratory rate. Respiratory rate is significantly higher, that is, it is greater than 35. Now when you look at the MS, that is a mental status, it is nothing but the individual remains confused, as well as the individual is lethargic. Next, the urine output, as we discussed, it goes minimal. So here in class 3 it was 5 to 15. Here it is going to be minimal, that is lesser than 5. To learn and grow daily like this, please do subscribe.